when you talk about critical race theory. It came out of the U.S. Law schools in the 1990s, and then they just sort of spread, and they also become powerful ideas because activists sort of glom onto them because they give them sort of the power to push change that they want to see in society. And I don't know, it's a hard thing to map out in a couple of seconds, but it has been a long, slow process, and we're seeing the effects of it now, where if we were paying better attention in the 1990s or early 2000s, we might have been able to nip it in the bud, but we weren't.
I'm Tamara Ugolini here with Rebel News in Cape Breton, Nova Scotia for the Free Speech and Medicine Conference. I'm joined by lawyer Lisa Bildy from Libertas Law. Now, I suppose just as a broad overview of the topic here and from a legal perspective, what role does the administrative state play in suppression of free speech or freedom in medicine?
Well, it's playing a huge role, actually, and a growing role, as administrative states tend to do. They're growing, becoming more intrusive into our daily lives. So in terms of free speech in medicine, where we're seeing, I guess, some of the biggest issues right now in terms of speech is regulatory bodies. These are the bodies that decide whether you're licensed as a physician or a psychologist or even a lawyer, and many of them have sort of taken it upon themselves in more recent times to want to control the speech and the opinions, even sometimes the beliefs, if we look at our law society, of the professionals that they regulate. And so they view their mandate as increasingly expansive. And that does have an impact on it has a chilling effect, essentially, on whether physicians can feel comfortable speaking up against the prevailing orthodoxy on whatever topic.
It's on us. We can't just complain about it and point out the crazy. The legal system isn't going to save us. The institutions aren't going to save us. And probably the politicians aren't either. The legal system generally and increasingly reflects the values of the current culture. And politicians won't act unless they think it's politically expedient to do so.
But those who challenge the narrative, and oftentimes who did so in a way where they were presenting evidence, they were speaking eloquently, they were being polite and professional, they still were taken to disciplinary proceedings for their comments. So it was a bit of a a double standard that we were seeing. So it's not so much that some people are above the law, but it's that the standards are applied differently and inconsistently,
which does kind of lead to an unequal application of those standards and the broader spectrum of the law. How did it become so that these fringe theories became this kind of full frontal attack on the law and the legal space?
Well, it sort of happened over time, I suppose. And you have to remember that this has been going on for probably 20, 30, 40, 50 years of these sort of ideas taking hold. And so I think, they start getting into the education system. They start being sort of discussed and presented in places like law schools. When you talk about critical race theory, it came out of the U.S. Law schools in the 1990s, and then they just sort of spread. And they also become powerful ideas because activists sort of glom onto them because they give them sort of the power to push change that they want to see in society. And I don't know, it's a hard thing to map out in a couple of seconds, but it has been a long, slow process, and we're seeing the effects of it now, where if we were paying better attention in the 1990s or early 2000s, we might have been able to nip it in the bud, but we weren't.
We've let far too much go, and we need to get back to first principles. And I'm sorry, but if it's your side doing the canceling, as much as it feels satisfying to watch them get a taste of their own medicine, the same principles have to apply. Except for the incitement of violence, which is criminal speech, and defamation, for which there's a civil remedy, the state should not be interfering with speech by and large.
The belief during at least the early stages of COVID was that we really all need to row together. And I think the colleges took the powers that they had, and they to my in my opinion, they overreached by telling all doctors, I'm thinking of Ontario in particular, told all doctors that they really had to abide by and promote what the public health officials in the government were saying. And, to me, that seemed to be astonishing and inappropriate, because the public health doesn't, first of all, they were all doing something very novel that wasn't part of the pandemic plans. And so some criticism was certainly warranted, and some scrutiny was warranted, which they were essentially prohibiting. But I think it came from a place of, we have a problem, we all need to get together, and if too many people are questioning it, then the public won't do what they need to do to keep themselves and others safe. But it didn't take too long before we sort of had a better handle on what we were dealing with COVID, yet those policies and edicts stayed in place for a lot longer, and it became very difficult then for doctors who wanted to raise the other studies, the other critiques, the data, to be able to do so in a way that didn't jeopardize their careers, and that I think was a huge problem. And so may have started with good intentions, I'll give it that, but I think it should have not continued as it did.
It was crucial for us to fly here and travel extensively in order to reach this far back corner of Canada to provide exclusive coverage of this conference titled Free Speech in Medicine. If you appreciate that we can give you this kind of on-the-ground reports and conduct investigative journalism in person, then please consider donating and chipping in what you're able to help offset the costs of our coverage and our travel expenses at rebelfieldreports.com. At that website, you can also check out our reports as they continue to come out on this topic at this conference. All of that and more at rebelfieldreports.com.